So good morning. Today we have gathered here to celebrate World Cancer Day. So this World Cancer Day is celebrated worldwide, and the main emphasis is on generating awareness for early detection, prevention and effective treatment. So major focus is on early detection and prevention aspects. So we will be discussing all those things. My name is Lalit Mohan Sharma. I am working as faculty in Department of Medical Oncology in Shri Ram Cancer Center. I welcome you all on behalf of Department of Medical Oncology, Department of Community Medicine to this hall. We have done some competition also about the cancer awareness, and the UICC theme, Close the Cancer Care Gap. So we have some competitions also about that, and we will be giving awards and certificates to the winners, which will be declared at the end of this activity. With this we will start the formal beginning. So we will be first doing with lamp lighting ceremony, and may I request Professor G.N. Saxena sir, Dr. Swati Garg madam, Dr. Hemant sir, Dr. R.G. Sharma sir, Dr. D.P. Singh ji, Dr. Narendra Padiyar, Dr. Girraj Soni ji and Dr. Rajat Vora to come here on the stage for the formal inauguration of today's CME. So this meeting is being organized by Department of Medical Oncology and Department of Community Medicine, and the students of MBBS cadre, dental students and nursing students, they have participated in the activity in the competition sessions. So may I request all the dignitaries to be on the dais please, so that time is saved. And to begin with, may I request Professor G.N. Saxena sir, who is Pro Vice Chancellor, to say a few words about the vision of MGUMST for cancer care in the future.
Well, good morning everybody, and it's indeed a pleasure to see a large number of people this morning, which is quite unusual for functions like this. So that means we are actually getting people to understand what is going on, and some people are interested, especially in the topic of the day, that is bridging the gap in cancer care. And even if we are able to communicate this to half our present audience, we'll have moved forwards. As Professor Malhotra said, that there is a large difference in the care available for various groups of patients, which has been bridged in the last few months. I won't say last few years, but in the few months, with the advent of various insurance schemes, government support. And to this I would like to add, there is one more component to it, and that is the awareness of the availability of treatment. Now, even in the medical faculty, and which means not just the doctors who are treating them, but in the paramedical, the paraclinical, associated medical fields, Ayurvedic, Unani, if there is an increased awareness of the availability of treatment for specific malignancies, it would go a long way. Because when a patient first undergoes or is diagnosed with a malignancy, the first reaction, of course, for the patient and his family is that of shock. And they are almost numbed and they don't know what to do. But when they approach their treating doctor, he may be a person having a small clinic in the neighborhood, or he may be a general physician, or he may be a physician in his nearby area. He also does not have much awareness. Aare bhai wahan chale jao, jo naam suna hua hota hai, us pe chale jao. And that's where the awareness campaigns for the lay people in general, but specifically for the medical persons, would come in, would be of great help. And probably the awareness increase even if it's there in the nursing staff, and because that's the point of contact for a large number of our patients. And in you will be surprised the word that I'm going to use, even the nearby chemist shop. Those people have to be aware of the available treatments for various what are treatable, what are not treatable, and to be able to refer them to the right person at the right time. I, as a physician, know of several patients who have had cases which, had they been detected in the beginning, बहुत शुरू में उनको अगर मालूम पड़ जाता, तो their treatment line would have been different, their prognosis और उनकी morbidity बहुत कम रहती है. लेकिन awareness की कमी और जो लोग उनको treat कर रहे थे उनमें awareness की कमी की वजह से वो disease जो थी वो progress करती गई. So when Dr. Malhotra talked about the cost of treatment and the availability of treatment, I think he has hit the right buttons. And the duty of people who are in the field is to make everybody aware of the centers. And maybe if there is a website or a connecting site as to where not everything can be available across the country, but you can have specific knowledge on the center, on that website, that this is available here, this is available there. So even the medical doctors and physicians would be able to access it and direct the patient directly to that particular area. As far as the funding is concerned, yes, it is still a major challenge. Even with insurance, there are upper limits, and people who have had a recent insurance for that matter, maybe 6 months, 8 months back or a year back, are often denied treatment because they say that this thing kicks in only 6 months after the insurance, kicks in 1 year after the insurance, and so many other logistical problems. Now with more centers available, more and more medical colleges coming up, and as we see the signboards all across the city, within a few months we'll have 30 districts with medical colleges. And obviously we expect the medical college people to be more aware of things than the routine doctor sitting in the periphery as a CAS or probably in the non-government service or in his own private clinic. So we must focus not just on patients getting aware of the thing, but also the doctors getting aware of the treatment available and the methodology of the funding of treatment. I'm sure people sitting here will be more than enthusiastic to learn about these things, and they'll be then able to help the society in general. Thank you.
Thank you so much, Professor G.N. Saxena, sir. As sir has rightly mentioned that the gap is not only at the national and international level, but the gap is at the medical level also. So rather than teaching only the patients and the government, we all should be learned, we all should know about the cancer aspects, and we all need to be upgraded time to time. And I am sure that under the able guidance of Professor G.N. Saxena, Professor Hemant Malhotra, Professor R.G. Sharma, we all will do much better than what we have done in past, and we will be a leading example in the state to teach about cancer in various medical colleges. So, thank you so much, Professor G.N. Saxena, sir, for your words of wisdom. Now may I request Dr. Raj Govind, sir, to come and deliver few words about the cancer aspects, the overview as well as some data about the cancer.
Good morning, dignitaries in the dais, of the dais, friends. Why should we be sitting here today? Is cancer such an important problem that we have to come here, stop the hospital work? Everybody comes here, the principal is here, all the dignitaries are here, students are here. Why should we be here? How many of you know of a cancer patient or a family where there is a member of cancer? कितने लोग बाग हैं जो कि या तो कोई कैंसर पेशेंट को जानते हैं या किसी फैमिली को जानते हैं जिसमें किसी कैंसर पेशेंट को हुआ है? So, there you see, the problem is not a simple problem. It is a very complex problem. Cancer is not just a problem of one person. It is a problem of the family. And the theme today is bridging the gap. जो सारे गैप्स बताए हैं वो तो हैं ही, लेकिन मैं एक दूसरा गैप बताता हूँ जो कि भरना बहुत जरूरी है. वो गैप है इंटरनल गैप. अवेयरनेस हो, पैसा हो, फैसिलिटीज हो, सब कुछ है, लेकिन जैसे ही पेशेंट डायग्नोज होता है, क्या बोलता है वो? मेरे को कुछ नहीं कराना है, मेरे को छोड़ दो. This gap has to be taken care of. अगर जबरदस्ती वो हॉस्पिटल आ भी गया, क्या होता है? इतना बड़ा हॉस्पिटल देख के 10 जगह चक्कर लगा के घर चला जाता है, मेरे को नहीं आना है. Next day he doesn't come. This gap has to be filled, and this responsibility is ours. This responsibility is yours. This responsibility is of the students, the nursing students. You people, we people can play a very big role. The role that you can play is, main hoon na. If there is a patient, you get along with him, tag along with him, and say, I am with you. If just this much is there, you take him to the hospital, get him investigated, leave him home, whatever. Whichever way you can help that patient, that would be the biggest gap that you can fill. I've been given the mandate of giving you the statistics to tell you why cancer is important. But before that, what is cancer? To be able to understand cancer, we need to understand nature. एक पेड़ होता है, छोटी पत्तियां आती हैं, उन पत्तियों को दूसरी वाली पत्तियां संभाल के रखती हैं. जैसे जैसे वो बड़ा होता है, दूसरी पत्ती खुलती है, बड़ी पत्तियां गिर जाती हैं, छोटा एक पेड़ बन जाता है. This is the normal mechanism in nature. Similarly, this is the mechanism in our cells that you all know. That every cell knows what it has to do. It has to grow, it has to function, and then it has to drop off. Cancer cells do not follow these rules. Cancer is exactly like terrorism. Who's a terrorist? A terrorist is a person who does not follow rules. He wants to make his own colony. He takes others' things. He spreads to other places, creates havoc in the society. Exactly that. The reasons also the same. If somebody is irritated so much, whether it is because of tobacco, alcohol, any other things, he will become a terrorist. Similarly, cells become terrorists, whether it is physical, chemical, biological, or radiation, whatever reason. So these cells become terroristic. And most of these things are responsible, we are responsible. एक छोटी सी कहानी बताता हूँ आपको. जब सृष्टि की रचना हुई थी, तो भगवान ने कहा कि अगर सब चलते रहेंगे तो दुनिया चल नहीं पाएगी, because everybody will live, अमर है, सब चलते रहेंगे. तो then they asked कि कौन responsibility लेगा कि इनको खत्म करके नया वापस से चालू करना है. None of the देवतास was ready कि मैं मौत का देवता बनूंगा. तो then everybody said कि कुछ तो करना पड़ेगा, सृष्टि चलानी है, अपने को नया साइकिल चलाना है. Then a formula was devised कि जो एक देवता मृत्यु का देवता बनेगा, उस पर कोई रिस्पॉन्सिबिलिटी नहीं होगी, कि कोई उसको ब्लेम नहीं करेगा कि तुमने मारा है. रिस्पॉन्सिबिलिटी उन्होंने मनुष्यों पे डाल दी. वो क्या कि ये खुद ही अपनी मृत्यु का कारण बनेंगे, या तो कुछ गड़बड़ करेंगे, या कुछ इनका खान पान में गड़बड़ होगी, या कोई अपने आप बीमारी पाल लेंगे. So this is one of the reasons why cancer is there. It is a lifestyle disease, whether it is alcohol, tobacco, obesity, or the behavior, or lack of exercise, food, whatever it is created by ourselves. Now, just to give you some of the statistics, every year about 96 lakh people die of cancer in the world. 1 in 6 deaths is due to cancer. 1/3 of all cancer deaths are due to tobacco, obesity, alcohol, decreased fruit and vegetable intake, decreased exercise, and pollution. In low-income countries, 30% of the cancers are due to HPV virus and hepatitis. Every year, 4 lakh children develop cancer. What about India? In India, the total number of people who have cancer at any given time is around 22 lakhs. हम कोविड के लिए तो हर दिन देखते हैं कि जयपुर में कितने हुए, आज 2000 हो गए, आज 1500 हो गए. कैंसर के लिए कभी देखा है? Every year about 11 lakh new cancer patients are diagnosed in India. There are about 7 lakh cancer related deaths per year, जिसमें men 4 लाख के करीब होता है और women 3 lakhs. What is the risk of developing cancer in Indians? In males it is 9.8% and females 9.42%. What is the risk of dying from cancer before the age of 75? 7.34 in males and 6.28 in females. 25% of the cancer deaths in males are due to oral cavity and lung cancer, which is directly proportional to the smoking and tobacco use. In females, breast and oral cancer, mouth cancers account for 25% of the cancers. Just top 5 cancers amount for almost 50% of all the cancers that are in India. In men, the common cancers are mouth, lung, stomach, colon, rectum, and esophagus, whereas in females, it is breast, mouth, cervix, lung, and stomach. These incidences vary from place to place. In America, this is slightly different. Prostate is very common. In Northeast region, incidence is very high. In Gangetic region, gallbladder cancer is high. Why is this? This directly points to our lifestyle, what we are doing to ourselves. These cancers can be prevented, screened for and detected early and treated at an early stage. This could significantly reduce the death rate from these cancers. 1 woman dies of cervical cancer every 8 minutes in India. For every 2 women diagnosed with breast cancer, 1 dies of it. 3,500 persons die every day due to tobacco use in India. And tobacco use accounts for 3,17,000 deaths per year. So you can see. You will say, why doesn't the government ban tobacco? Everybody knows the tobacco industry gives a lot of funding and everywhere. So it is very, very difficult. It is banned, tobacco as such is banned, but you can see the pan masala and gudka, which is freely available, or sugandhit supari and all those things. And they start as kids. Everybody, small kids, and you wait for 10 years. These people all will develop cancer. We feel we are doing 6 hours of useless surgery. One commando takes about 6 hours. Excision, neck dissection, mandibular resection, and then reconstruction. Why? Because it is a self-inflicted disease. It is because of tobacco. The patient goes home again, starts smoking, comes back again with a recurrence. So you can see how addictive it is. You give me 5 minutes to talk about breast cancer. Breast cancer is the most common cancer in women in India, accounts for about 14% of all cancers in women. New cases registered are 1,62,000. Death from breast cancer is about 87,000 per year. The incidence rates begin to rise in the early 30s and peak at the age of 50 to 60 years. Overall, 1 in 28 women is likely to develop breast cancer during her lifetime. This is more so in urban areas, where it is 1 in 22, and rural areas where it is 1 in 60. Probably somebody will take care of why this difference between urban and what can be done. What are the risk factors? Gender, age, family history, genetic factors, the menstrual history, past history of breast cancer in one bed, obesity, pregnancy, lactation, alcohol, hormone intake, and radiation and ionization. What can be done? I think ideal body weight is to be maintained, exercise regularly, quit smoking, breastfeed the baby, avoid unnecessary radiation exposure, and prevention by genetic testing. What are the common signs and symptoms? A mass or lump, change in the size, shrinkage of the breast, unevenness of the breast, dimpling, inverted nipple, redness or scaling, uneven pores or orange peel appearance of the breast, swelling of the lymph nodes, whether in the neck or the axilla. And breast self-examination is a very important thing that every female should know how to check her breast. As far as the second most commonest cancer, which is the cervical cancer is the second most common cancer in India in women, accounting for 22.86% of all cancer in women. New cases registered are 96,000, deaths are about 60,000. Mean age of developing cervical cancer is 38 years. Rural women are at higher risk. Again, you will be told about why rural women are at higher risk. Cervical cancer is less in Muslim females, reason being HPV infection. Cervical cancer is mostly diagnosed in advanced stage, mostly in 80% of the cases. It is the third largest cause of mortality in India. Survival rate is only about 50%. Only about 50% of the cervix cancer patient survive 5 years. And the length of survival depends on where the patient, or at what time in the stage was the patient diagnosed. We will also talk about the HPV vaccination. When should you consult a doctor? Abnormal vaginal bleeding or spotting between periods, longer or heavy periods, bleeding after menopause, excessive vaginal discharge, foul smell, bleeding after sexual intercourse, lower abdominal or pelvic pain, and pain during sexual intercourse. And now coming to the last part, the oral cancer, mouth cancer, which is the commonest cancer. India has 1/3 of oral cancers in the world. So we are leaders of oral cancer. Oral cancer accounts for around 30% of all cancers in India. New cases about 1,19,000, deaths about 72,000 per year. In general, more men suffer from and die from oral cancer than women. Oral cancer is the second most common cancer in India amongst even women also, because they also use a lot of tobacco. Around 80 to 90% of oral cancers are directly attributed to tobacco use. Mean age is around 50 years. Incident rates for oral cancer among females is significantly higher than males. The survival rate, patients with early stage of oral cancer survive about 82% 5-year survival, and patients in earlier stages, in late stages, only about 27% 5-year survival. What can be done? Avoid tobacco in all forms, no alcohol, plenty of fruits and vegetables, and even if there is a slight abnormality, get it checked up. जब अपनी गाड़ी का पोल्यूशन चेक कराते हैं हर 6 महीने, अगर नहीं कराएं तो उसका पेनल्टी होती है, तो ये गाड़ी से तो ज़्यादा महंगा है. Get a medical checkup regularly. Consult anything in the mouth. If you can't open your mouth, simple thing is try and open your mouth and put your 3 fingers in it. If you can't put your 3 fingers in it, then you need to get a checkup. That means you are having trismus. So when should you consult a doctor? Persistent sore in the mouth, difficulty in opening in the mouth, white patch, red patch, a hard mass in the neck, pain in the mouth, difficulty in chewing, swelling, thickness or lump, bleeding, change in voice, ill-fitting dentures, or unexplained weight loss. And like I said, what is the cause? It is the interaction between the patient. It is a concept of seed, soil, and environment. Generally, you must have seen patients say, ये तो 20 साल से तंबाकू खा रहे हैं, गुटखा खा रहे हैं, इनको कुछ नहीं हुआ. इन्होंने तो सिर्फ अभी 5 साल खाया है और इनको हो गया. तो they give the example कि जो लोग खाते हैं उनको कुछ नहीं होता है. So it is a concept of seed, soil, and environment. एक बीज आप यहाँ बोएंगे, नहीं उगेगा. दूसरा बीज बिल्डिंग के ऊपर उग जाता है. पीपल का पेड़ देखा होगा, बिल्डिंग के साइड पे उग जाता है. वहाँ ना तो पानी है, ना मिट्टी है, ना कुछ भी है, लेकिन वो उग जाता है. So do not think that these risk factors are not important. Whatever is said today, take it to heart, help as much as you can, and bridge the gap. Thank you very much.
Thank you so much, sir, for your words of wisdom and very energetic and realistic data, in fact. And when it comes to data, it becomes a bunch of patient or it becomes only numbers. When it comes to individual, it becomes a person, it becomes a life, it becomes a family. Principal Madam wants to leave early, so may I request Principal Madam Dr. Swati Garg to say a few words about today's program and the vision of cancer in MGUMST. Over to Dr. Swati Garg, please.
Good morning. At the outset, I want to thank the organizer, Dr. Hemant sir, Dr. Lalit, to invite me for this very good initiative of a toy bank which they have made at the SRCC building. and that has been made for all the more better cause of donating these toys to the cancer children. Thank you, sir, for that. And secondly, I request every one of us to join hands for the theme of the World Cancer Day, that is closing the care gap. And how all we can help is, the experts have mentioned, and let us do our part for this day. Thank you.
Thank you so much, madam.
Thank you so much, ma'am, for sparing time for today's activity. So now we will be having another talk, and this time Department of Community Medicine, Preventive and Social Medicine, they are associated with us in this cancer prevention program. So may I request Professor Rajat Vora, who is professor in the Department of Community Medicine, to say a few words about how we all can unite, how we all can try to prevent cancer at different levels. Over to Dr. Rajat Vora, please.
A very good morning to all. Why I am here today is because we have, Dr. R.G. Sharma sir has talked about the data, how the cancer is increasing day by day. Now the time has come that cancer has become a public health problem. When sir inquired from you regarding how many of you know any one cancer patient, everybody almost raised his hand, his or her hand. So the prediction of UN, United Nations, is by 2050, almost every family in India will have one cancer patient at least. This is why it has become a public health problem. The incidence, cancer statistics 2020 says 94 males in 1 lakh have cancer right now, and 113 female have cancer per 1 lakh females have cancer right now. So this is, and cancer along with all non-communicable disease follow a iceberg phenomenon. What is an iceberg phenomenon? You must have seen an iceberg on a sea level. All of you have seen the movie Titanic. Titanic में क्या हुआ था कि टाइटैनिक शिप के सेलर को ऊपर का आइसबर्ग दिखा. That was 10 to 20% of the iceberg. Rest 80 to 90% of the iceberg was below the sea level. Same holds true with cancer. What data we are publishing is only 20-25% of the data. Rest 75% of the data are undiagnosed. Sir said कि stage 3 और stage 4 में आते हैं. क्यों आते हैं? क्योंकि वो undiagnosed हैं. They are hidden cases. How to extract, how to detect, the most important aspect in cancer detection is screening at community level. Sir talked about 2 types of cancer. I'll talk about 4 cancers today. 2 most common cancers in male, oral cancer and lung cancer. In world, lung cancer is most common, but in India, oral cancer is most common. The reason behind is we chew raw tobacco. Gutka, pan masala, khani, we chew raw tobacco, which is the single most common reason of very high prevalence of oral cancer in India. We talk about female. Earlier, a decade before, sir also mentioned about it, a decade before, cervical cancer was more common in females in comparison to breast cancer. Now the trend is changing and the breast cancer is becoming more common in females, especially in urban females in comparison to rural females. The reason behind is breast cancer is more common in nulliparous women. And those women, either those women who have never been pregnant or those women who never breastfed their children. Or breastfeeding is lowers the incidence of breast cancer. So in urban society, we usually teach undergraduate students that it is mandatory to have exclusive breastfeeding for 6 months. But in urban society, you will never see a woman breastfeeding, exclusively breastfeeding her child for 6 months. So screening, I talk about screening. oral cancer, how you can detect in community? By bimanual oral examination. It is a bimanual oral examination where one finger, the treating surgeon or treating doctor, wear a gloves. He'll palpate the oral mucosa and he'll look for, sir talked about white and red patches, that is leukoplakia and erythroplakia. Sir also talked about three finger, if someone, that is submucosal fibrosis. These three are predictors of oral cancer. So anybody, any tobacco chewer who is coming for any complaint, or at community level when we are doing survey, if somebody has having risk factors of oral cancer, never forget to check his oral cavity. Second comes lung cancer. Lung cancer, those who are having risk, smokers, are having higher risk of developing lung cancer. So chest X-ray is usually done as a screening test to detect lung cancer in early stages. Coming to breast cancer, which is most common cancer in women, breast self-examination, usually the most commonest site of breast cancer is upper and outer quadrant. So what is recommended is a female can examine her breast herself and look for any lump, and followed by, if at all there is in screening it comes, then it is recommended to do mammography for her. Next comes cervical cancer, which is again a very, very common cancer, and the most important risk factor of cervical cancer in India is human papilloma virus infection. Lack of hygiene is also, so in rural we recommend regular pap smear examination of the women. Secondly, now there is a vaccine, human papilloma virus vaccine, Gardasil, which is given by IM route, 2-dose or 3-dose regimen. So Gardasil vaccine, it is now high time that Gardasil vaccine, to prevent cervical cancer, Gardasil vaccine should be included in national immunization schedule. This is how about screening. And one more, why there is a, world statistics shows there is 2% rise in cancer incidence every year. So one of the matter of research is effect of radiation on human body as well. We all are living 24/7 in Wi-Fi zone nowadays. This could also be a reason for increased incidence and prevalence of cancer, which is a matter of research. In another 10-20 years of time, we'll be able to find the proper conclusion. Various studies will be conducted and we'll be able to find whether radiation could be a cause for increased incidence of cancer. Thank you.
Thank you so much, Professor Rajat Vora, for exciting talks and the data and real ground situations, that how at community level we all can participate in early detection of cancer and partly in prevention of cancer. So today's focus is mainly on prevention and early detection. We talk less of treatment. So with this we come to the end of the first part of today's CME, and I thank Professor G.N. Saxena sir, Professor Swati Garg, Professor Hemant Malhotra sir, Professor R.G. Sharma sir, Professor D.P. Singh sir, Professor Narendra Padiyad sir, Professor Girraj Saini ji, and Professor Rajat Vora for their inputs and for their contribution in today's work. Thank you so much, sir. So next will be a panel discussion, and may I request Dr. Nitin Khuteta, who is senior surgeon here, cancer surgeon here. He is associate professor in the Department of Surgical Oncology. Here, Dr. Nitin Khuteta, please come here. Dr. Ajay Yadav. Dr. Ajay Yadav is senior medical oncologist and he is associate professor in the Department of Medical Oncology in SRCC. Professor Vikas Singh. Professor Vikas Singh ji is professor and he is professor in the Department of Oral Maxillofacial Surgery in the Dental College in Mahatma Gandhi University. Dr. Bhartendra Sharma. Is Dr. Bhartendra Sharma ji here? Thank you, Dr. Bhartendra ji. So Dr. Bhartendra Sharma ji is professor in the College of Nursing. We have tried that we take help from all the colleges, dental college and the nursing college and medical college dignitaries along with the cancer specialist. May I request Dr. Rajat Vora. Dr. Rajat is here or he has gone out? So Dr. Rajat Vora is professor in community medicine. You have listened to him in the previous talk. And I am requesting each one of you to contribute whenever you feel like. You can raise your hand and give your inputs. We'll be talking very basic aspects of cancer, nothing very high-end cancer-related thing. So I'll start with Dr. Nitin Khuteta, who is cancer surgeon with us. Dr. Nitin, may I ask you that which type of common cancers you see in the clinical practice?
गुड मॉर्निंग एवरीबॉडी. जो ओपीडी में हमारे पास जो केसेस आते हैं, द कॉमनेस्ट कैंसर वी एनकाउंटर इज इन मेल्स लंग कैंसर एंड ओरल कैविटी कैंसर, एंड इन फीमेल्स ब्रेस्ट कैंसर एंड सर्विक्स कैंसर.
Right. And second question is to you only, that what number of cases or what percentage of cases are coming in early stage in your practice?
Generally what we get is 60 to 70% patients who are advanced stage. So less than 20 or 30% patients we get in early stage. That's also a very high number, but we get around 10 to 15% of patients which are in early cancer.
So I think that is very important, and this is the gap, that why do patients do reach to a cancer center in third or fourth stage? Why 70 to 80% patients are reaching late? What can we do to reduce the gap? What can we do for early detection so that patients are reaching to us early? Previously we were feeling that financial background or finances are a real barrier, but now with the Chiranjeev Swasthya Yojana, everybody has got a free treatment scheme available to them. Still patients are not able to reach to the cancer center, so there is a significant gap. And may I ask Dr. Vikas Singh. Dr. Vikas, oral cavity cancer is very common as discussed. Still the oral cavity cancer cases are coming too late. So what are the possible reasons according to you?
One is patients come with non-healing ulcers. They neglect it for quite a long time. There's no regular dental checkup currently practiced in India also. So and then the lack of training to examine the patient in early stages, red and white lesions, what we see commonly. So this might be the cause.
Dr. Nitin, what is your thoughts on the neglect of oral cavity cancer? हर आदमी कम से कम एक बार तो अपनी शक्ल कांच में देखता है नहाने के बाद में. And oral cavity is such a thing which one cannot miss. But still we see third and fourth stage cases.
हमारे यहाँ जो अवेयरनेस है वो बहुत कम है. सो अवेयरनेस अपन सब ब्रांड एम्बेसडर्स हैं जो सब यहाँ बैठे हुए हैं, अपने फैमिलीज में, अपनी सोसाइटी में अवेयरनेस डेवलप करें कि जो भी तंबाकू खाता है, किसी भी तरीके से तंबाकू का सेवन करता है, तो वो ज़रूर अपना मुंह को जो खोल के एक महीने में एक बार ज़रूर देख ले. जीभ का हिस्सा है, तालू का हिस्सा है, लिप्स का हिस्सा है, बकल म्यूकोजा है, कि कहीं पे कोई लाल चकत्ता या सफ़ेद चकत्ता है या नहीं. अगर है तो उसको इन्वेस्टिगेट कराएं. यही छोटा सा एक टेस्ट है, जैसे लास्ट टॉक में भी राजगोविंद शर्मा साहब ने बताया, 3 फिंगर टेस्ट. आप मुंह खोलिए और 3 फिंगर्स को डालिए. अगर 3 फिंगर्स नहीं डाल पा रहे हैं, इसका मतलब सब म्यूकस फाइब्रोसिस हो रहा है, तो उसमें कैंसर होने की संभावनाएं नॉर्मल से ज़्यादा बढ़ जाती है. ये छोटी छोटी चीज़ें हैं जो अवेयरनेस है, ये हमें डेवलप करना है सोसाइटी में. एंड ये छोटे छोटे टेस्ट हम खुद भी कर सकते हैं अपने घर पे. मुंह देखना है, मुंह की जांच करना है महीने में एक बार, जिससे कि हमें मुंह की स्थिति की मालूम चल जाएगी. और अगर कोई छाला है या गांठ गले में डेवलप हो रही है या चकत्ता सफ़ेद या लाल डेवलप हो रहा है या मुंह खुलने का जो रेंज है वो कम हो रहा है, तो वी शुड सीक कंसल्टेशन विद द एक्सपर्ट. जितनी जल्दी हो सके डॉक्टर के पास जाएं और अपनी मुंह को चेक कराएं, ताकि अगर बीमारी डेवलप होती है तो उसका अर्ली डायग्नोसिस हो.
I think very well said, and we all will agree that जो कैंसर की अर्ली स्टेज में डायग्नोसिस की जिम्मेदारी है वो सिर्फ डॉक्टर्स की नहीं है. वी ऑल हेल्थ केयर वर्कर्स जो जहाँ जिस पोजीशन में भी है, वी ऑल कैन कंट्रीब्यूट इन अर्ली डिटेक्शन एंड प्रिवेंशन. प्रोफेसर रजत वोरा जी ने अभी क्लियरली बताया दैट एट कम्युनिटी लेवल वी टीच ऑल द डॉक्टर्स कि अपनी टेबल पे एक टॉर्च रखो. डॉक्टर, नर्सेज, डेंटिस्ट, एवरीवन शुड फॉलो दैट. एक टॉर्च रखो एंड पुट ए टॉर्च लाइट इन पेशेंट्स ओरल कैविटी फॉर 2 seconds. You may pick up a lot of information there. And especially when you put a torchlight and tell a person, तंबाकू खाते हो क्या, पेशेंट का मन में तुरंत आ जाता है कि मेरे अंदर कुछ गड़बड़ तो नहीं है, कैंसर जैसा तो नहीं बन रहा. सो आपका उस पॉइंट पर इंटरवेंशन करना, उस पॉइंट पर कहना विल हैव सीरियस इम्पैक्ट, and they will follow, and if any symptoms are there they will go for the further checkups. Probably हम लोग ये करते हैं that we don't see them. हम सोचते हैं बीपी के लिए आए तो बीपी नाप देंगे, डायबिटीज के लिए आए तो डायबिटीज का काम करेंगे. We don't see them. Even breast cancer का पेशेंट आया और गुटखा खा रहा है, probably many of us forget कि इसकी oral cavity भी देखें, and we try to teach them not to chew tobacco or not to smoke. Many times we have seen patient गुटखा जर्दा खा रहा है, सिगरेट बीड़ी पी रहा है, उसका ब्रदर, उसका फैमिली मेंबर, वो उसके साथ वाला, ही इज ऑल्सो कंज्यूमिंग द सेम थिंग. So it means we are probably not treating the family in toto, we are treating only the sick person. Our job should be to create wellness. हमारी सोसाइटी में वेलनेस होगी, जो हमारा मुख्यमंत्री जी का नारा होगी है निरोगी राजस्थान. तो निरोगी जब रहेंगे, पहला सुख निरोगी काया, ऐसा होगा तो ही प्रोबेबली हम लोग सब हैप्पी एंड हेल्दी रह पाएंगे.
सर इसमें एक चीज और ऐड करना चाहूँगा.
Yes,
अगर आपके फैमिली में कोई तंबाकू ले रहा है तो अगर उसको आप काउंसिल करें कि वो डी एडिक्शन कर सकते हैं. आजकल डी एडिक्शन क्लिनिक सब जगह अवेलेबल है, वहाँ उनको ले जाएं ताकि तंबाकू को कैसे धीरे धीरे वो छोड़ दें. अल्कोहल अगर ले रहे हैं तो धीरे धीरे कैसे छोड़ दें. तो इसके लिए हर लेवल पे, पीएचसी लेवल पे या सीएचसी लेवल पे, इवन यहाँ पे भी सब जगह डी एडिक्शन क्लिनिक्स हैं, एक्सपर्ट्स मौजूद हैं जो डी एडिक्शन कर देंगे ताकि उनका तंबाकू सेवन करने का जो प्रॉब्लम है वो धीरे खत्म हो जाएगा और उनको कैंसर होने की संभावनाएं कम हो जाएंगी भविष्य के अंदर.
I think that is very right, that de-addiction centers, and unfortunately most commonly the responsibility and liabilities like to doctors and nurses only dealing in the cancer field. May I ask Dr. Bhartendra Sharma ji that Dr. Bhartendra ji nursing staff हमारा है, it's a big strength to the medical health system. डॉक्टर्स कम है, नर्सिंग स्टाफ हमारे पास रिलेटिवली उतने कम नहीं जितने डॉक्टर्स की कमी है. नर्सिंग स्टाफ कैसे ग्राउंड लेवल पे कैंसर के अगेंस्ट इस खिलाफ जो लड़ाई चल रही है इसमें भागीदारी ले सकते हैं?
यस सर. तो जनरली सर, एज सर टोल्ड दैट अवेयरनेस इज द सिंगल मोस्ट प्राइमरी प्रिवेंशन स्टेप, and the level of prevention we know primary, secondary, tertiary. So at this primary level, by creating simple awareness, like you talked about the tobacco cancer, तो उसका जो लेबल होता है, स्मोकिंग का जो पैकेट आता है या गुटखा का जो पैकेट आता है, उस पर क्लियरली मेंशन भी होता है गवर्नमेंट की तरफ से कि इसको इफ टेकिंग इज वेरी डेंजरस एंड हार्म. लेकिन उसके बाद भी अगर हम जनरल पब्लिक में देखें तो लोग उसके बाद भी खा रहे हैं उसको. तो यहाँ पर क्रिएटिंग अवेयरनेस, so our staff nurses, of course in the OPDs, they are, when the patient is coming, creating awareness to the patient, and in the community our nursing students are going to the community visits, they are creating awareness there. And at the CHC, PHC level, the nursing staff's main role is to create awareness regarding how to prevent the cancer, and in that they are focusing on the screening aspect, like breast cancer, breast self-examination. There are many social stigmas in the societies also, like in the rural areas. Persons who are having breast cancer, especially females or males having prostate cancer, they are not exposing also. So the nurses are going and talking to them and providing them opportunities that explore that. If they will not explore, then the conditions will develop, as the sir told Rajat Bora, iceberg phenomena. So it will increase more and more if they will not come forward and report the problem. And as health professionals like physicians and doctors, we cannot also help at the higher level when it will convert into the malignancy. So creating awareness, that is the single most preventive aspect. If proper awareness is created, the problems can be minimized to a greater extent. And second aspect in the hospital, I will say that palliative care, that is the new aspect is coming in this cancer care. So the palliative care, the nurses has to be strengthened about this training, that how the palliative timely, if the facility is there, so that palliative care can be provided to the patients in the hospitals and in the community level and at the home level also. So like this, in these areas, the nurses is providing care to the patient.
I think that is very, very well said. Nurses are the biggest strength, especially in the oncology field. And in Western world, it is the nurse practitioner who does most of the job, in fact, related to the screening, counseling, and doctor's job remains the treatment part. So nurses are big strength, and if we can train our nursing staff, especially during the training of their nursing, maybe GNM or BSc or whatever training course they are in, if we can train them about the cancer aspect, the basic general aspects, the things will improve. When they go in the periphery, then things will be much better than as compared to what we are seeing today. To our nursing curriculum also, we from the Department of Oncology, we have added few classes that we will be taking their classes. Of course, we have taken for few of them, but again we want to develop a good curriculum for oncology nursing training course, and probably in due course of time we will have better infrastructure and better designed modules, in fact, for the nursing care in the oncology. Dr. Ajay Yadav, let me start again with you, that what do you feel the gap in the cancer care patient? So the UICC is determined, we all are determined that we will try to close the cancer care gap. So what are the points you want to mention about closing the cancer care gap?
Sir, most important thing is awareness. People are not aware for early diagnosis. If cancer is diagnosed in early stage, means stage 1 or stage 2, the survival rate is 80 to 90%. And if they are diagnosed in late stage, in stage 3 or stage 4, the 5-year survival rate is reversed. Means they have only 5 to 10% chances of 5-year survival. So the most important thing in cancer management is early diagnosis, early diagnosis, early diagnosis. And this only can happen when people are aware for it and they undergo the screening program. Here in India, we don't have any screening program. Even the health care providers are not using the screening program. If you ask to our doctors, how many of us are advising our family members to undergo for mammography for the female members? So only few, because we have seen the outcome of the disease. So we should all need to know that we should go for a screening. In female, most common cancer is breast cancer and cervix cancer. And these both cancers can be diagnosed in early stage, and we can cure or more than 90% patients if they are diagnosed in stage 1 or stage 2. So that is the main thing in management of any cancer patient management.
I think that is very right. And about the screening part, again I want to, yes sir, just a minute sir. About the screening part, I want to emphasize again that around a year back we started female cancer screening program in this institute. And Swarnkar Sahab declared that we will be doing this free of cost. I requested him for 1 month and he said no, we will continue doing free of cost screening for the women cancer. But unfortunately, out of the 1,400 women strength working in Mahatma Gandhi University, less than 100 got screening done. We tried to teach them about the cancer aspect, and then we tried that yes, we will emphasize and we will promote them so that they come forward for screening. Unfortunately, till date, we are not able to penetrate their brain properly, in fact. Annette's sister is here, and she also tried probably for the nursing students and nursing staff to get the cancer related lectures and followed by screening, but we could not get yet. So things are available here only, things are available for free of cost, but still we are not able to do that. So again we need to be more worried about that. Yes, on each day or each birthday we do our screening so that we can pick up cancer cases early. Professor D.P. Singh sir has something to say.
Cancer care, filling the gap of cancer care. in my opinion, this is very important. I think this is for continuing for 3 years.
Yes, sir.
Not only for this year.
Yes, sir. 3 years.
Why it is so important? In my opinion, the inequity in the cancer care cost, and second thing is the accessibility of the quality care, or you can standard of care of the cancer patient. I belong to a village, remote village, that is 250 kilometers from this place. In between there is no cancer center. If you go to Bikaner, again 300 kilometers. If you go to Delhi, again 220 kilometers. So very, very important is to make the availability of the cancer care center standard. And this is very difficult task to make the availability of the cancer treatment centers every place. Why? Villagers are to come in the Jaipur is very difficult. In Jaipur we have 7 centers. If you see the why I say inequity means kahin pe bhi samanta, I think there may be some difference, but we have some facilities for the free treatment because the government has given. And in spite of that, simple, I belong to radiotherapy community. The radiotherapy is required in most of the or more than 2/3 cases of the cancer patient in any form, either it is a palliative, adjuvant or radical. But if you come to the cost of the treatment, same machine, if you want palliative, very less. If you want 3D CRT, the cost is in 40,000-50,000. It may cost vary from center to center. Second thing, if the same patient is planned for the IMRT, the cost goes to the in lakhs. If you go slightly higher, image guided or other newer techniques, the cost goes again 5 to 6 lakhs. If any patients who needs proton beams, cost goes 50-60 lakhs. So this inequity to fill the gap is very, very difficult, sir. That's why it has been taken. We have to make the strong voice, not ourselves, but we have to approach the government. It is political decisions. Very difficult to fill this gap. I don't think in the 3 years you will fill this gap of inequity and availability of the standard of care for every patient. Still very, very difficult. Anyway, the theme is very good. We must try, all must try to fill this gap, and we make our voice stronger and stronger by any means. Thank you.
Very true, sir. Thank you. So we all need to unite together, and there are many things which government can do, and there are many things where we all can contribute. We need to see that what I can do. We will do whatever best possible from our own individual efforts, as departmental efforts, as a university level efforts, and we can try and pursue the government. So this is a constant ongoing process. But according to me, each one of us can contribute in the continuum of the cancer care at various platforms, various levels, and we should perform our own duties, in fact. So, Dr. Vikas Singh ji, I am coming back to you, that about the dental students, how they can contribute in early detection of oral cavity cancer, prevention and early detection. The dental students, how are we making them, initiating about the disease part?
Yeah, one is the oral cavity examination. They are the first people to see through the oral cavity. So whenever they come across any red or white lesions or even lumps around neck, I mean, they have to be well versed with the examination part. And if they have any doubt, which is any ulcer which is more than 2 weeks, it's better they intervene and educate the patient and refer to the proper higher centers. Also, any patient who is suspected of having any addictive habits like tobacco, chewing, they have to be having a high suspect rate there, and make the patient aware that this percentage of having a cancer is quite high in your case, and regular follow-up is a must. So overall, they can contribute in early screening as well as outreach activities, awareness activities related to tobacco-related cancers, and educate the patient as well as diagnose it early.
Thank you. Thank you so much. Professor Rajat Vora, we have heard about screening part. So can you say a few words about the opportunistic screen, like many patients are coming to us for something or else. So is it somehow possible that we screen them like a women coming for any other issues?
Yes, sir. Yes, sir. All the screening tests can be done. Like suppose women is coming for any routine checkup or something like that, or she has some knee pain or back pain, we can motivate her to do pap smear and mammography to rule out cervical cancer and breast cancer. Similarly, in males, hypertension and diabetes is very common. So if at all the patient is coming for general checkup or high diabetes and hypertension, we can just look for leukoplakia, erythroplakia, just do an oral examination. Oral examination itself will tell you, and you will be able to diagnose more than 50% of the hidden cases in the community who don't know they are suffering from oral cancer.
So I think that is also very important, that we have a large number of OPD patients. Many of us faculty members and nurses are going for outreach activity. So we also pay some attention on their opportunistic screening. Somebody coming for something and we try to screen them if they agree for that. So these are few tips we have discussed about the cancer and overall burden and how we all can contribute. And any questions or any comments from anybody from the audience? Yes, sir.
Sir, thank you for, first of all, thank you for inviting us, and also congratulations on holding this important event.
Thank you.
And as a representative of the dental fraternity, I would like to mention few things. One is you asked about the role of dental students. The dental students are being, trained theoretically. It is there in their curriculum. Most of the aspects are there in the curriculum, the preventive as well as, the diagnostic part. But on the ground level, I don't think we have, given emphasis to routine cancer screening for every patient. So because this is a huge opportunity, and today I take this opportunity. I am also personally, I've been impressed, and that we also should do something. So I think we will design a leaflet in consultation with the oncology department, and we will give this leaflet to every patient who comes to the dental college. At least they take it home. They are aware. I mean, like Bhartendra sir said, these photos of oral cancer is being printed on the smoking, the cigarette packs. I don't think it has created much of a difference. Even if you go to movie theater, the first thing we see is that video. Even that, I think, is not deterring patients from smoking and all those things. So I think we have to create a sort of a leaflet, videos, which you can play regularly in our clinical setup, so that the more the people see that, I think it will be, it will be effective. So we will develop a leaflet and give it to every patient from now on. That is one thing which came to my mind. That is one responsibility of the dental college. We will do it. And since 30% of cancers, you said, are oral cavity, it's a huge responsibility also on dentists. The Indian Dental Association has been carrying out cancer screening and awareness program for the last 5-6 years. But the thing is, like you said, sir, keeping the motivation from the professional side, it's very difficult, because patients do not agree to even a simple biopsy. Even in the patient comes for a simple filling, and if we advise him, see, there is a white patch, let us go for biopsy, they do not agree for it. I'm sure Dr. Vikas also will agree. They are very, scared that it will turn out to be something positive. So I think we have to educate patients to go for these biopsies, and and also I'm not aware. Around 7 to 8 years back, there was a simple kit devised for early detection. It's instant. It gives instant results. I don't know if we have any kits like that. If there are kits like that, we can definitely, in a non-invasive way, if you can detect, pre-cancer or cancer I think it will be a great thing. I want to just know whether there are there any kits available?
In fact, sir, there have been few studies published in the literature where with the help of artificial intelligence, they are trying to figure out the lesion in the oral cavity is normal or pre-malignant or malignant. But the validation of that has not been much great in fact. So yet it is in pipeline. Probably in next few years we may have some device which can probably take out at the community level without biopsy. Probably high suspect can be in fact generated on that device. So that is in pipeline.
Okay. One last thing I would like to mention, sir. We have a tobacco cessation center in the dental college, even though it is not very active, but I think we will activate that also. The Dental Council of India has mandated all dental colleges to have a tobacco cessation clinic, and we have a dedicated facility for that in the dental college, and we will work on that also, sir. Thank you so much.
Thank you so much for your inputs and promising word, and truly appreciate about the poster part. I think this is a small thing, but this can make some difference in the overall understanding and generating awareness about the cancer. So I think in the interest of time I'll stop here, and may I request all my panelists here to say one message on the World Cancer Day, one punchline what you want to communicate today. So starting from Professor Rajat Vora. On World Cancer Day, one punchline from you.
Screen every patient coming to you.
So screen every person coming or every patient, whosoever comes to you, screen. Very good, sir. Thank you. Professor Bhartendra Sharma ji.
I would like to comment that increase awareness by teaching the patient about the hazards, or means finding out the symptom as early as possible and reporting that to the healthcare personnel.
So increasing awareness is the key. Very good. Thank you so much, sir. Dr. Nitin Kutetaj.
Cancer is preventable.
Very good. So prevention. Very good. Thank you.
So मैं बताना चाहूँगा कि हम सभी को वार्निंग साइंस के बारे में पता होना चाहिए कि कैंसर के वार्निंग साइंस क्या हैं. तो जितनी भी ये बच्चियाँ बैठी हैं, मैं चाहूँगा कि सभी we should know about the warning signs so that we can diagnose it in early stage.
Yes, sir.
I think regular checkups be implemented so that even in those cases you can catch up the cases.
So I think that awareness, screening and regular checkup, these are the three major crux of today's discussion. So with this I thank all my learned panelists, Dr. Nitin Khuteta, Dr. Rajat Vora, Dr. Ajay Yadav, Dr. Vikas Singh, Dr. Bhartendra Sharma, Professor D.P. Singh sir, and Dr. Narendra Padiyat sir for their excellent inputs. Thank you so much. So with this we come to the end of today's academics, and now the last part left over is about the poster competitions. So may I invite Professor Rajat Vora. Dr. Rajat, please don't go. So we had this time, it was Dr. Rajat Vora's idea that we will have a poster competition, and this will be e-competition. So Dr. Rajat, can you tell us about the poster competition and the results also, so that we can distribute the certificates?
We organized a poster competition for the students of medical college, dental college and nursing college. Total we received 30 poster competition. The jury consisted of my faculty members of my department and faculty members of medical oncology. They have selected few posters who have been awarded first, second and third prize in poster competition. We'll be distributing the certificates.
So may I invite Dr. Priyanka Soni to announce the names of the winners of competition. Dr. Priyanka, please come here.
Thank you, sir. So we'll start with the nursing students first. Okay. So we have seen the posters. They are on the display and made very nice posters. So the among BSc Nursing, we have two people on third prize. The third goes to Miss Parmeet, GNM Nursing. Please come on the stage and collect your prize as well as certificate.
So may I request Giriraj ji or Bhartendra Sharma ji also to come on the dais for giving certificate to them. Requesting Professor Narendra Padiyat sir also, Dr. Nitin Khuteta also to please come here.
So Ms. Parmeet from GNM Nursing got third prize. Another third prize goes to Ms. Anjali from nursing student. Please come on the stage. Second prize goes to Ms. Rihika. Ms. Rihika, please be ready over here. Okay, Ritika. All of you, please give them a big hand. They have really done hard work to make those posters. Third prize to Ms. Anjali. Second prize to Ms. Ritika. And for the first prize, I would like to call upon Ms. Vanshika. Kindly clap for them to encourage them to do more posters and more good work. Among the dental students, the third prize goes to Ms. Priyanshi. Second prize goes to among dental students, third prize goes to Ms. Priyanshi. Ms. Pragya, please be ready. So second prize goes to Ms. Pragya. And I would like to call upon Ms. Kriti. Please come near the stage. Second prize to Ms. Pragya. And the first prize goes to Ms. Kriti. Among the MBBS students, I would like to call upon Pratyakash. Please come near the stage. Third prize goes to Pratyakash. Pratyaksh. Mr. Pratyaksh. Ms. Nehal. So I would like to call upon Ms. Nehal, and she has got the second prize in poster competition among MBBS students. Audience, please keep on clapping. And for the first prize, I would like to call upon Ms. Nidhi. Ms. Nidhi among MBBS students for the first prize in poster competition. I think she's absent. She'll collect it later. Okay. Thank you.
So thank you so much, Dr. Priyanka Soni and Dr. Archana Paliwal for helping us in the award distributions. And with this, today's meeting comes to an end. On behalf of Department of Medical Oncology, Department of Community Medicine and the organizing committee, I thank each one of you for your active participation and I congratulate all the winners. My special thank goes to Professor Rajat Vora for his constant inputs, and I am glad that with our meeting together we will have much better things in cancer prevention and non-communicable disease prevention and its early detection. With this we end up, and thank you so much. God bless you all.